everyone, and welcome to the second video that we're doing here for the Ambulance Mini Medics. And this time we're going to talk about CPR, which is cardiopulmonary resuscitation. You would have seen it on the telly and things like that, but we're going to show you how to do it properly. So we've got a very willing volunteer. Mildred, one of our friends, has come along to help us. Also, look, she's given us a little wave and everything. Also, we've got Hannah, which is one of our training officers here at North East Ambulance Service and also helps out with the Ambulance Mini Medics. So unfortunately for us, Mildred has taken a bit unwell. She's got a bit of pain in her chest. So using our doctor's ABC, Hannah is going to come in, checking for danger, trying to get a response off Mildred.
Mildred.
She's probably going to have to get her on the floor from the chair the best she can.
Grab hold of you. Bring it out the floor.
Now she needs to shout for help.
Help! Help! Tony, help!
What's wrong?
I need to ring an ambulance.
I'll go now, straight away. So the next bit's going to be airway. So usually we would look into the mouth and see if there's anything blocking the airway. However, during this time of COVID, we wouldn't be checking this. We would just be checking to see if they're breathing, as Hannah is doing now. You're going to be doing this for 10 seconds to make sure that there's no rise and fall of the chest. So after the 10 seconds, Hannah should be 99% sure that Mildred is not breathing. So we are now going to have to start CPR. So you can see there that Hannah's doing chest compressions to Mildred. We're putting our hands in the centre of the chest and we're doing this between 100 and 120 beats per minute. Also going at the depth of 5 to 6 centimetres deep on an adult. Always remember, guys, to make sure that you never ever do CPR on somebody who's still alive. So when you're playing about or practicing, never ever do that. If you're going to practice, please try it on a pillow or one of your teddy bears. So like we've already said, A is for airway. Open the patient's mouth, make sure there's nothing visibly blocking the airway. Tilt the patient's head back, lifting the chin to open the airway. However, in this time of COVID, we will not be doing this. B for breathing. Look at the chest for the rise and fall. Listen at the mouth for the sound of any breathing and feel any air being blown onto your cheek. After that, you will be 99% sure that that patient isn't breathing. So you are going to start CPR. So keep your arms locked. This will be hard. However, you need to do 30 chest compressions. The rescue breaths aren't so important. So if you can't do the rescue breath, just continue with the chest compressions. Again, in this time of COVID, we will not be doing any sort of mouth to mouth. We must also, it's really important that we're pushing 5 to 6 centimetres deep. And that's 30 chest compressions, should take about 15 seconds. So babies and infants are a little bit different. We're going to do 5 initial rescue breaths, okay? We are then doing 15 chest compressions to a further 2 rescue breaths. We are going 4 to 5 centimetres deep on the baby, and that's using 2 fingers in the centre of the chest. For an infant, it's exactly the same, but because that child's a little bit bigger, we're going to use 1 hand. Once 999 has been called, it will be a Cat 1 response, meaning a 7-minute response from the ambulance service. The closest ambulance to you will be dispatched. Again, guys, thank you very much. I hope this is all making sense, and I hope you're learning something from it. And I look forward to seeing you again in the next video. Bye bye now. Thanks to the good work of Hannah doing CPR and the excellent work of Tony going to ring for an ambulance, Mildred has survived and she's absolutely fine and making a good recovery. Thanks very much, guys, and we'll see you on the next video.